Hello, good afternoon and welcome to the Count Electro-Homeopathy Forum, West Bengal. Today we will discuss about the Irritable Bowel Syndrome, I.B.S. and Electro-Homeopathy. This Irritable Bowel Syndrome is very common gastrointestinal tract disorder. About 20% of patients suffering from gastric disorder may suffer from I.B.S. disease, and it is a big problem, causes a lot of mental agony to the patient as well as to the physician who face a challenge treating this disease. Now this I.B.S. is characterized by chronic gastrointestinal tract symptoms like number 1, recurrent abdominal pain, especially in lower left quadrant. Second, altered frequency of defecation, frequent loose motion, diarrhea or constipation, and sometimes both alternately. The third is unsatisfactory evacuation or a sense of incomplete evacuation. And fourth, that is feeling of abdominal distension and flatulence, etc. The electro-homeopathic concept of I.B.S. is the disturbance in the normal functioning of gut is the result of dysfunction of any organ or system. Natural faculties like retention, expulsive, digestive and absorptive organ and symptoms that lead to either diarrhea or constipation. As for etiology, there is no established etiology and organic pathology involved in I.B.S. Hence, this alteration in the bowel habit may be attributed to the dysfunction of its normal retentive faculties, which either fail to retain the diet for ample amount of time and causes diarrhea, or causes excessive retention of diet in alimentary tract, thus resulting in constipation. Though all the faculties of alimentary tract get affected in these conditions, electro-homeopathic physicians have credited retentive faculty to play a pivotal role in the development of these symptoms. Out of them, some additional facts or factors are like number 1, mucilage that coats the surface of alimentary tract and makes the diet difficult to retain, and it slips down easily, causing frequent defecation. Second is abnormal non-substantial temperament or abnormal substantial temperament of retentive faculty may also result in its dysfunction. Third, laxative effects of some medicines may last for long duration, thus propelling the diet to evacuate before digestion. Fourth, rigorous physical activity soon after meals. And fifth is the increased heat in the alimentary tract due to digestion of rich diet also lead to dysfunction of retentive faculty. The weak and improper digestion can lead to accumulation of toxins, bringing vitiation of either lymph or blood or both at a time, and all the major symptoms of I.B.S. can be a result of these toxins. That's why the first step in electro-homeopathy treatment of irritable bowel syndrome is the treatment and reduction of toxins, and in this way body is detoxified and vitiation of blood and lymph are brought into balance. This can be distinguished into 4 major types based on bowel habit. Number 1 is constipation prominent I.B.S., that is sanguine. Diarrhea prominent I.B.S., that is bilious. Dysentery prominent I.B.S., that is lymphatic. And when a person encounters a combination of all the above symptoms, that comes under the head of mixed one. Now about diagnosis. So diagnosis of IBS is mostly done on the basis of clinical history. The main thing which we have to know, that the widely accepted Rome theory diagnostic criteria in clinical practice is to be justified as under some heads. That is, number one, the onset of symptoms at least 6 months before diagnosis. Number two is recurrent abdominal pain or discomfort more than 3 days per month during past 3 months. And the last is to list more or two only of the following feature should be there, that is the improvement with defecation, onset associated with a change in frequency in stool, and onset associated with change in stool. For these are the symptoms of Rome 3 diagnostic criteria. Now we have to manage the IBS under some heads by taking some precaution in our daily habit or in our lifestyle modalities. So first, let's know the diets in IBS. So to all the patients of IBS, they have to reduce the intake of fried foods, processed foods, meat, oil, dairy foods and other fatty foods. Why? Because these food items can cause the colon to contract abruptly, causing IBS symptoms like diarrhea and abdominal pain. Number two is avoid spicy foods. Why? Because it makes your large intestine go into spasm and thus causing diarrhea. Third, taking more soluble fibers which can help or prevent diarrhea. The available sources of these more soluble fibers are beans, oat milk and some fruits such as apples, strawberry and grapes. Then after, we have to take sufficient water, because less water intake can obstruct the smooth flow of food in the tract. So avoid taking water while you eat. Taking water 1 hour before and after your meal will help considerably. Then the patient have to eat yogurt or any kind of probiotic food. They have to eat rice, aged rice, or you may say old rice, jawar, skimmed milk, buttermilk, and along with that they have to consume vegetables like gourds, coriander leaves, lentils and gram soups. Then they also have to take fruits like pomegranate, nutmeg and certain herbs like black pepper, dried ginger, garlic, cumin, turmeric, coriander, cinnamon, clove, belva and fenugreek that can help in IBS because of their healing property. Then the patient should not forget the important part played by sound sleep in digestion and overall health. It means the patient have to take sound sleep. Then patient should take buttermilk, sauerkraut, arista, and they should be taken as post-meal drink. So this is all about the precautionary measure taken for food. Then we have to come to lifestyle modification which are recommended in IBS. So in this we are again going to take some parts from the previous one, as the patient have to increase dietary fiber intake, take probiotic foods like curd, simki, etc. Then key point is to identify and remove food intolerance, as this can be different from individual to individual. Patient also have to manage stress level, both physical as well as psychological. They have to focus on maintaining healthy lifestyle. They have to learn to eat the right food and prepare to combine food properly, which can give maximum health benefit. It is recommended to eat according to the individual's constitution. This simply means that they can follow a diet that is suitable for their body, for their health. Ginger, that soothes most of I.B.S. symptoms, so they can use it in morning tea and other drinks. Peppermint oil can be very effective, as it helps relax the muscles of the gut to improve motility, means the pass of food through the gut. And patient may be also beneficial while taking aloe vera in the treatment of symptoms of diarrhea and constipation. The anti-inflammatory properties of aloe vera reduces inflammation in the gut and can pacify many of the symptoms of I.B.S. Other than this, in their lifestyle modification, patients have to go through the yoga practice, because some poses patient may try doing daily, and this can help long-term relief in I.B.S. Out of them, mainly they have to practice mainly Dhanurasana, Pawanmuktasana, Marjariyasana, Adhomukh Svanasana, Ardha Asana, and Bhujangasana. But one thing always should be taken in mind, that these practices must be done under the strict supervision of the experts. In electro-homeopathy, there are several medicines based on symptoms of I.B.S. that can be easily controlled, because the treatment of I.B.S. is mainly based on symptoms control by using some medicines. It gives a chance to other alternative system of medicines, even electro-homeopathy, to explore their potential in successful management of I.B.S. Electro-homeopathy text contains description of many drugs that are found to be effective in controlling the symptom of I.B.S. Some of them are this S1, S10, S3, C10, etc. In the management of this symptom I.B.S., we may prescribe for abdominal pain S10 and S-LAS, if that is due to constipation. If there is diarrhea or any sense of evacuation after taking food, they have to take scrofloxacin 10. In severe constipation, scrofloxacin 10 to 20 globules twice daily with lukewarm water. When the patient suffer from diarrhea alternate with constipation, they have to take scrofloxacin 5 to 10 globules to be dissolved in water before meal, alternate with scrofloxacin dry 5 to 10 globules after meal, and scrofloxacin 10 to 20 globules to be taken twice with lukewarm water. If there is abdominal distension, patient have to take scrofloxacin 10 globules after each meal. If patients suffer from nausea and vomiting, so they have to take scrofloxacin 11, S11, and alternate with scrofloxacin after each meal. If there be flatulence and bloating, they also have to take S1 before meal and S10 after meal. And if the patient suffer from tiredness, they have to take Febrifigo-1 alternate with white electricity WA. But one thing always to be taken in mind, that in electro-homeopathy medicine, two or more medicine should not be mixed together. If you have full confidence over the materia medica, over the medicines, the single individual medicine is to be prescribed. Count-meti never mix two or more medicines together. So according to electro-homeopathic philosophy or principle of alteration of drugs, if we go through that chapter written by Count-Meti in electro-homeopathy medicine, we will get there that anywhere Count-Meti have not mixed two or more medicine together. So always be cautious about that. Try to give medicines individually. There is need to prescribe two or more medicines. You have to give them separately at alternate time, or you can give alternatively. If suppose one medicine you are giving in the morning, the second one you may give in the noon, and third you can give in evening, and as it you can prescribe according to the availability of the time to the patient. Now there are some therapeutic effects. Why we use Scrofloxacin, 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 F1, S-LAS, S11 in I.B.S. Number one, Scrofloxacin, that is considered as universal remedy for the entire metabolism, stomach, intestine with glandular appendages, secreting, stimulating metabolism and appetite. If regularly used, it influences in an extraordinary favorable way the whole constitution. It significantly augmented the immune activity by cellular and humoral mediated mechanisms. Scrofloxacin, it reduces the severity of intestinal inflammation in animal models of I.B.S. skin, dermatoid and hypodermic cellular tissues, eruptions, chronic herpes, dry and moist one. The sensible nervous system, nervousness, intestinal mucous membrane when secretion stops. Scrofloxacin, it reduces the severity of intestinal inflammation in animal model of I.B.S, chiefly against nervous gastric indigestion and acute diseases. Against symptoms of colds, 20 to 30 globules in a cup of decocted water every 5 to 10 minutes, a child's this teaspoonful. This remedy is chiefly used in all type of gastric disorder. It also significantly augmented the immune activity by cellular and humoral mediated mechanisms. Scrofloxacin 11, S11. Pharynx and gastric nerves, nausea, retching, vomiting, nausea and vomiting of pregnant women, similar indisposition at railway and during sea trips, vomiting with sick headache. Scrofloxacin, it is most essential and useful remedy for all type of constipation. It is purely intestinal remedy. It stimulates the mucous membrane, especially of the great gut, intestinal gland and nerves. General laxative during constipation, 20 to 30 globules to be given with lukewarm water or milk. Cancerostin, it reduces stomach cramp through its antispasmodic activity. It acts on the mucous membrane of the intestine, nervous trouble of the gastric intestine canal, large and small intestine, great gut, liver, gallbladder, milt and its tumor. Cancer also works nicely in the persons having tendency to chronic constipation and cures them. In this condition, supplementary medicine, Scrofloxacin, Febrifigo-1, Scrofloxacin, etc. should be also used. Last one is Febrifigo-1. It reduces stomach cramp through its antispasmodic activity with S10. So these are the special medicines of electro-homeopathy which can be used very successfully in cases of I.B.S. and I think if this medicine be properly used in proper way, proper dilution and proper mode of alteration following principle of electro-homeopathy, then there is no doubt that we can cover I.B.S. very easily, smoothly and rapidly. So this is all about I.B.S. I hope you the people may go through the chapters in books and must follow this in your practice. I think you must get success. Thank you very much for today.